You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back. May is a month for mothers. Not only is it Mother's Day, but there are a variety of different health events going on to talk about the health of mothers in Arkansas. I'm joined now by Representative Denise Garner. She is a Democrat of Fayetteville, Secretary of the Department of Human Services, Kristi Putnam, and Representative Karilyn Brown, Republican of R-Sherwood. Thank you all three for being here, and I guess happy Mother's Month is coming up, so all that. All right, you guys have a big event coming up on Thursday, May 2nd at the state capitol. I want somebody to tell me, Denise, you start off. What's going to be happening that day?
Absolutely. So May is the National Maternal Health Month, and so we are kicking off that month in support of everyone out there trying to help mothers both before and after babies with their health care. So we're sponsoring a showcase of vendors and healthcare professionals, wellness specialists, all on the Capitol steps to hand out resources and support women in whatever way they can for National Health Month.
It's from 4 o'clock to 7 o'clock.
4
at the
o'clock
state
to
capitol,
7.
Thursday, May 2nd. And what is, I kind of tout it as a health fair in some respects. Is that what it is?
That's
Kristi?
exactly what it is.
Yeah.
It's a health fair. It is in support of and in celebration of National Women's Health Month. Governor Sanders has made very clear that maternal health and women's health is a priority. We know that healthier women have healthier babies and are healthier after. So it is a health fair. We will have health screenings of different kinds. The UAMS mammovan will be there. We will have healthy food vendors, just all kinds of things, activities. We've got some yoga that will be going on. So there's all kinds of things to join.
Will there be goats there? Will there be goat yoga?
TBD. We have not decided on the goats yet.
All
That
right.
might be the special permit, but.
All right, Karilyn, whose brainchild was? Where did this all kind of stem from?
Well, I think Missy Irvin came up with this idea. It's a great idea. We want to encourage women of all ages to take better care of themselves, and we know a lot of times people just let things slide. But also we want to draw attention to the fact that there are health units in every county. The health department has a unit in every county, and there's many, many resources available to not only women but the entire family. But we're trying to put some emphasis on women taking better care of themselves.
Yeah. Arkansas ranks worst in the country in terms of the states and District of Columbia in terms of women's health, in terms of maternal mortality.
Right.
Why is that? What are the drivers of that?
Well, there are a lot of reasons, I think. One is access, and so that's one of the things we want to do is make sure that every health department, we have a health department in every county, so we want to make sure that people understand that, and that each one of them has resources for maternal care and for women's health in general. And then the other thing is pre-existing conditions, and so we want to educate people and work with the wellness component so that we're eliminating high blood pressure and diabetes and all of these things that are pre-existing conditions, determining the health of the mother and the infant as well.
Yeah.
I've heard horror stories of women that, and some of it's cultural in some respects, that they don't go see a doctor until they're ready to give birth because they don't have any health complications that they know of before then. How do you turn that around?
So I think, really how you turn that around, and I do want to talk quickly about the numbers. We have about 35,000 births per year in Arkansas. Of those births, there are about 10,000 women who don't seek care during their first trimester, and about a little over 1,000 don't even have any health care until they actually arrive at the delivery, when it's time to deliver the baby. And so we do have a lot of pre-existing conditions that go unseen, unknown, until it's complicating that labor and delivery event. And so, really it's about how do we get trusted partners out in the communities? How do we really lean on, we've been talking about midwives and doulas and community health workers, but more than that, how do we get the information, to sisters, mothers, husbands, fathers, really to help that woman know how important it is to go get that prenatal care. And that's a prevention factor that we at DHS are hyper-focused on all things prevention, but we've really doubled down and tripled down in the maternal health realm, especially with the conversations that Representative Brown mentioned with Senator Irvin, Representative Bentley, with the health department with Secretary Mallory, the Surgeon General, Dr. Chandler. And all these conversations have been happening sort of in isolation of each other. We as a state have now decided we're going in this direction to make sure that we support healthier moms and healthier women.
Yeah, Representative Brown.
Well, and we feel like a lot of conditions like high blood pressure and diabetes could all be, those numbers could come down if people had the education to know that a slight change in their diet or a slight change in their activity, that people had the knowledge that they could be healthier, and that it's critical that we get this information out to people throughout our state.
Absolutely.
There's not much going on in the fiscal session that's going to address this issue other than just you're funding some budgets for some things on this. But there has been, I think there was a shift in terms of some money for UAMS.
Some money was shifted during one of our budget amendments sponsored by Representative Mary Bentley that will allow UAMS to train certified nurse midwives. I delivered with a midwife. I did not see a doctor the entire time I was pregnant, and I know that midwives can do a fantastic job, and so I'm very excited about this.
You're a nurse. You're a nurse practitioner.
I am a nurse practitioner.
Yeah, nurse practitioner.
I'm a nurse practitioner, and one of the other things that we did was start a trust fund for UAMS for any kind of professional that deals with maternal health. So we want to make sure that not only are we certifying midwives, and we're really excited about that potential program, but also adding some fellowship or some time for general practitioners, family practice docs to deliver, and then adding nurse practitioner, all of the healthcare team. We're talking about doulas that are not actually healthcare, but in advocacy and support of the patient. So they're part of the healthcare team. So all of those things, we're trying to raise funds for all of those things to happen. It takes a village.
And I want to make sure I did more than just have a midwife deliver my child. The midwives cared for me during my pregnancy.
Right.
We did all the lab work. We did all the things we needed to do. It wasn't that I waited to the last minute. Yep. But and I didn't want anybody to think that I had not had proper care.
All right, listen, we're out of time on air, but I'm going to ask y'all three to stick around and let's do a web extra where we can talk about a few more things related to this issue. I'm with Representative Karilyn Brown, Kristi Putnam, Representative Denise Garner. You can catch our web extra on KARK.com or talkbusiness.net after the program airs here. Stick with us. We got a little bit more in the show. We'll be right back. Welcome back to this web extra. I'm with Representative Denise Garner, Democrat of Fayetteville, Kristi Putnam, Arkansas Secretary of Human Services, Representative Karilyn Brown, Republican of Sherwood. I'm coming to you first on this web extra. Kristi, what are some things that we could do to make a big impact or a dent in these not good maternal mortality statistics? Give me some easy things that we could accomplish.
Sure. So some easy things that we already have in progress. We're partnering very closely with the health department, and we've identified the 5 counties where there's the top percentage of women who do not seek prenatal care. And so the first thing that we've already started doing, and I say we, the health department has really been on the ground, is going out to those 5 counties and doing some additional education and outreach, getting out into the communities, working with community partners like the healthcare providers, but also with other community partners in the area to make sure that these women get connected to care at the earliest point possible.
Why do they not seek care early? Why is that?
Well, there can be a lot of reasons. You know, one reason could be, people don't like to talk about teen pregnancy. I'm going to talk about teen pregnancy. Teens find themselves pregnant and they're scared. You know, and many times it takes a little bit of time for women to talk about actually being pregnant. Some women, you know, there may be language barriers. There may be the thought that I'm already healthy, I don't need to go to a doctor. And so there are lots of different reasons why. You know, the perception that they don't have health care coverage, which in Arkansas, you know, there should not be a woman who does not have health care coverage, because we've expanded pregnancy coverage through Medicaid, and we have, you know, qualified health plans and all kinds of opportunities to access that care.
Yeah. What do you think are some easy things that the state could do, even if it requires a little bit of legislative initiative there? What are some things that could be done to change these statistics, change this trajectory?
I think doing everything we can, and that this may not be easy, is getting the care out to the rural areas. I know we've lost a lot of our rural hospitals. So if there's anything we can do to get those back open, we've lost a lot of our birthing centers.
Yeah, that has been a turn. What do you think?
I think if it were easy, we would have done it already. I don't think it's easy. I don't think it's easy at all. We have so many social determinants of health that are affected by poverty and zip code and so many other issues that are not easy fixes. But I do think there are a lot of things we can do to help, and that is to make sure that people know that the health units have resources and that they can get them to resources. We've got to help with transportation and with finances. So many minimum wage workers cannot take the day off. They can't afford to take the day off to go have health care. So there are a lot of things that I think are not easy answers, but certainly education and support and community partnerships. And I think that's a big thing. And that's one of the things that we're really trying to do with this and with the conference in Northwest Arkansas, trying to pull together the insurance companies and the providers and the businesses and the community leaders and the faith-based communities and everyone we can to make certain that people are getting the resources they need.
Tell all three of you on this, and probably Kristi will be the starting point on it. What's going to happen between now and the next regular session? You've got a task force that's working on some of this stuff. There's going to be some development of some legislative initiatives for the next regular session. You guys are going to be involved in that too. But tell me what's going to happen between now and the start of the next regular session.
We're very excited. We've already had our first meeting, actually this past Monday, of the Maternal Health Working Group and the Strategic Committee on Maternal Health that Governor Sanders put into place in the March 6th executive order. And the goals for that, we now have subgroups who are going out to work on education and outreach, improvements in clinical and non-clinical care, access to coverage and Medicaid improvements, and then also data reporting and technology, because we have systems that don't talk to each other. So I think a lot of what you're going to see is some of the outputs of those work groups. What are some recommendations that we can then take into the 2025 session, anything that needs legislation. But I think what you're going to see is more and more people just really coalescing around the maternal health and the women's health movement.
Might we see some bipartisan sponsors on this legislation?
I think that's the most exciting thing, is that we have bipartisan support, bicameral support. We are working together. We're doing everything we can to make sure we've got the same goals.
Yes.
And even are figuring out ways to get there together. So it's really exciting.
And getting people to go to their local health units, that is a step in the right direction. And these little journals, they're very, I read through this morning, they're very nice, and you can keep track of your blood pressure and your weight and things like that from year to year.
And these will be available at the May 2nd event. They're also going to be available at the local health units in each county, as well as, we'll make them widely available for distribution if it means that women are going to take that and take, note of what their health screenings are and what they need to work on.
Yeah, no pride of authorship on this. This
No,
is for
and
everyone.
it is non-proprietary as well,
Yeah.
so that if hospitals or clinics want to put their logo on the top, or if they want to make their own stickers, whatever they want to do to pull people in. We're also encouraging businesses to take a look at these journals, and as they're filled out, give discounts or
provide incentives.
That
Yeah,
State
exactly.
Chamber of Commerce in a headlock over there.
That's right.
I have
That's
reached
right.
out to both my chambers, the one in Jacksonville and the one in Sherwood, and they're both on board to help promote this and get our local businesses involved in, just providing a little incentive to get women to go get a checkup.
Yeah. All right, Thursday, May 2nd, 4 to 7 p.m., State Capitol. It's free. It's a huge, I'm calling it a health fair. You guys can call it whatever you want to call it.
It is, absolutely.
And there's going to be a lot of resources there for families, not just women,
That's right.
That's right.
families to
That's
find
right.
ways to be healthier about everything.
Yes.
Denise, Kristi, Karilyn, thank you all three very much for being here. Appreciate you.
Thank
Thank
you for
you.
having us.
Thank you.
Yes.
All right. Thank you for watching.
Thank you all.
Thank you.
Yeah.